Tuberculosis, or TB, is as old as man himself. In ancient times, it was known as phthisis, which means wasting away. It was first described by Hippocrates. A pulmonary infection manifesting itself as weight loss, a cough, and blood in the sputum, which gradually led to death. In the 16th century, Italian doctor Girolamo Fracastoro proposed the theory that the disease was transmitted by a microorganism invisible to the naked eye. In 1818, French physician René Laennec invented the stethoscope. Auscultation with the stethoscope revolutionized diagnosis of tuberculosis, but it was still not known how it was spread or how to treat it. Cures in sanatoriums were fashionable. Fresh air, rest, and a balanced diet were used both to isolate patients and treat them. In 1882, German physician Robert Koch discovered the tuberculosis bacillus that bears his name. From then on, it was known that Koch's bacillus is spread through the air. Nicknamed the White Plague in the 19th century, tuberculosis was a great romantic, carrying off Chekhov, Chopin, Kafka, and Schiller. During that century, it was improvements in living conditions and hygiene, not medical advances, that curbed the spread of the disease. It wasn't until the 20th century that the BCG vaccine was developed, and even more importantly, the first antibiotics capable of effectively treating the disease were discovered. Wealthy countries were finally able to forget the disease, until the 1980s, when it resurfaced along with the AIDS epidemic. People living with HIV have weakened immune systems, and so are more susceptible to tuberculosis. Meanwhile, resistance to antibiotics is becoming increasingly common. Every year, tuberculosis kills 1.3 million people. 9 million fall ill, of which 500,000 with a multi-drug resistant form, meaning antibiotics are ineffective. And these numbers are probably underestimated.